Welcome to our educational video on the Neonatal Resuscitation Program, a vital protocol designed to save newborn lives in emergency situations. In this presentation, we will explore the importance of neonatal resuscitation, key steps involved, and essential skills for healthcare providers. Neonatal resuscitation is a critical skill for healthcare providers involved in the delivery and care of newborns. It involves a series of interventions aimed at supporting newborns who are not breathing or are experiencing difficulty breathing at birth. The Neonatal Resuscitation Program emphasizes the TBCs: temperature, airway, breathing, and circulation. Let's break down these steps. Let's begin with the initial assessment, which includes 4 pre-birth questions. 1. Whether the baby is born at term or preterm. 1. Is the amniotic fluid clear? 1. Are there any additional risk factors like a twin pregnancy? 1. Discuss the umbilical cord management. This enables the neonatologist to prepare for resuscitation with equipment and personnel. Check whether the baby is crying after birth and has good tone. If yes, the baby's airway and respiration are normal. Routine care is given and delayed cord clamping is done. If not, early cord clamping is done and the initial steps are taken. First, maintain the baby's temperature by using a radiant warmer. Then stimulate the baby. This can be done either by gently rubbing the back of the body with a cotton towel or by tapping the sole using fingers. Ensure an open airway by positioning the baby's head and clearing any obstructions from the mouth and nose. A towel roll can be kept below the shoulder to keep the head extended backward. Suctioning can be employed if required. By this time, the baby usually starts crying. If the baby is not crying even after the initial steps, then assess the heart rate and respiratory effort. If the baby's heart rate is less than 100 per minute despite adequate ventilation, go for positive pressure ventilation, PPV, for 30 seconds using techniques such as bag mask ventilation at a rate of 40 to 60 breaths per minute, like doing breathe 1-2. Bag mask ventilation involves using a mask connected to a self-inflating bag to deliver breaths to the baby's lungs. Assess PPV after 15 seconds. If there is good chest rise and heart rate more than 100 per minute, stop resuscitation in case of baby having good respiratory effort. Continue PPV for 30 seconds in case of poor respiratory effort. If heart rate of baby is less than 100 per minute, go for MR SOPA, aka ventilation correction. It includes mask readjustment, repositioning of head, suction, mouth opening, pressure readjustment, or at last, alternate airway. If the heart rate is greater than 100 per minute along with poor inadequate respiratory effort, go for oxygen supplementation by CPAP. No response even after PPV or heart rate less than 60 per minute, go for chest compressions with ventilation. Chest compressions are necessary to help establish circulation. Technique: 2-thumb technique. Site: lower 1/3 of sternum, avoid xaphisternum. Depth: 1/3 of AP diameter of chest. Rate: 90 compressions and 30 ventilations per minute in 3:1 ratio. Once decided for chest compressions, preferably alternate airway is established. Cardiac monitoring is compulsory. Assess after 60 seconds. If there is no response to chest compressions, that is, heart rate less than 60 per minute, start adrenaline intravenously through umbilical vein. 1. 10,000 solution 0.2 milliliters per kilogram is administered. Continue chest compressions. If heart rate is greater than 60 per minute, continue PPV and stop chest compressions. Discontinue resuscitation if heart rate is 0 after 20 minutes of life. It's crucial for healthcare providers to be skilled and confident in performing neonatal resuscitation maneuvers, as timely intervention can greatly improve outcomes for newborns in distress. Regular training and simulation exercises are essential for healthcare providers to maintain proficiency in neonatal resuscitation techniques and to work effectively as a team in high-pressure situations. In addition to technical skills, communication and teamwork are vital during neonatal resuscitation. Clear roles and effective communication among team members can make a significant difference in the outcome for the baby. After any resuscitation event, it's important for the medical team to debrief, discuss what went well and what could be improved, and learn from the experience to enhance future performance. Thank you for watching our educational video on neonatal resuscitation.